Good day. Welcome to today's NIC Leadership Huddle called Senior Housing and Skilled Nursing, the State of the Market. This is the first Leadership Huddle of 2022, the webinar series. My name is Beth Mace. I'm the Chief Economist and the Director of the Research and Analytics Group here at NIC. Welcome very much. We appreciate you joining. We welcome your questions for our panelists during our discussion. If you'd like to ask a question, please submit your question in the Ask Question pane, which is located within the middle and towards the bottom of your screen. We'll address submitted questions towards the end of today's Leadership Huddle. Moving to our panel discussion, it's my pleasure to introduce today's panelists. We have Brian Beckworth, who's the CEO of Arcus Healthcare Partners, and Craig Hansen, who's the CEO of Omega Senior Living. Craig and Brian, thank you so much for being with us today. I really appreciate it. So let's start. Let's start. And with Brian, let's start with you. Tell us a little bit about Arcus and its formation in March of 2021. That's interesting timing. So why then?
So several different reasons. One, I was leaving one firm and transitioning to the next chapter, and after a non-compete and some work on the side, it was perfect timing. I thought, to begin the process of looking for some opportunistic investments. Given what our industry was going through, it seemed like we had an opportunity to find some transactions that may need the expertise that hopefully I've developed over the years, and we've been successful in finding some of those. So in March, closed on a portfolio that actually closed April of 2021, and then closed on another transaction in January of this year where we partnered with Craig. And then once another very capable individual came available, Cheryl Marcet, we joined together, and we have worked on some transactions as we pursue the types of kind of opportunistic things that we're looking for. So we thought it was an interesting time in the market, an interesting time in our industry, and we thought our expertise and capital relationships would put us in a spot where we could take advantage of that.
And you and Cheryl had worked together before, right, at GE Capital, is that right?
We'd worked together at GE Capital. I'm afraid I probably shouldn't say how long ago, but a long time ago. And then we also worked together at Formation Capital, and enjoyed that, and we had a lot of common experiences, and it's a very good fit. And so given that and some of the things that we had worked on from the capital side, it was a good time, and working to establish those relationships with folks like Craig and Lynn at Omega Senior Living. We've really enjoyed it so far.
That's great. Well, congratulations. I wish you great success. So Craig, tell us a little bit about Omega and what distinguishes you from other operators, and where you're located, and what you sort of focus on at Omega.
Sure. And let me give you probably a little background on myself first. First of all, thank you for having me here today. So I appreciate the opportunity. So I grew up in property management industry with a business that my father had founded in 1976 called Omega Management. Later, it was incorporated to the name Wygand Omega Management. So I lead that company today. That company manages apartments, everything from student housing to age-restricted senior. We do retail and office management, hotels and resorts, and self-storage units. So from that, in 2016, I founded Omega Senior Living, specifically for the healthcare purposes for senior living. So we do active adult 55 plus, IL, AL, memory care, skilled nursing, long-term care. So pretty well the full spectrum of senior housing services. I'm also involved in a development company that does 55 plus senior called JC Mulligan Development Group, and one of the co-founders and chairman of the board of Vital Core Health Strategies, which does the health, mental, and dental components for county jails and state prison systems. So got a very diverse background. Yeah. So in a nonprofit, that's in process of becoming a nonprofit called My Neighbor's Keeper National Foundation. So that we do a lot of
for Omega Senior Living, where are most of your properties located? What part of the country?
We've got properties in Kansas and Missouri, Nebraska, Oklahoma, and Louisiana.
Okay. So now you and Brian have done some deals together. So what's the advantage that you see with each other in terms of a partnership between Omega and Arcus? Either one of you guys can answer that.
A great deal of experience. So they bring a lot of experience and knowledge to the table. So it's been great working with Brian and Cheryl. The deal that came up that we closed on in January, we had been following closely. Gosh, I think it was maybe 2 years about that we had followed this deal. And so really it was opportunity. Deal came up. It was neighborhood was good. The bones of the property were good. And there was just operational opportunities that were available. And that's when we partnered with Arcus and made that acquisition. So,
okay. So we'll talk a bit more about that in a minute. I want to talk a little bit broader right now in terms of the industries, broad industries, senior housing, as well as skilled nursing. And I want to start with a discussion about the recovery to date. So toward that, I have some data just to put things in context, and then we're going to ask both you and Brian more specifically about your thoughts on the recovery timeline. So using data that I have access to through NIC Map Vision, I'm going to look at senior housing and just throw out a couple of data points if anybody wants to jot these down. So I'm looking at seniors housing for the primary 31 markets, NIC Map markets. And senior housing is comprised of both assisted living and independent living. So pre-COVID, so the first quarter of 2020, the occupancy rate was 87.2%, 87.2. It fell then during the pandemic quarters and months to 78% by the first quarter of 21. And then a year later, we're back at 80.6, so 80.6. So altogether, the peak to trough decline for senior housing was 9.2 percentage points. We've recovered about 2.5 percentage points of that. So it's still about 6.7 percentage points below that. So for nursing care, just for perspective, in the skilled nursing area, we lost 12.5 percentage points of occupancy, and we're still 9 percentage points behind where we were at the pre-COVID. And again, I'm using pre-COVID as the first quarter of 2020. So the recovery that we've seen to date, 2.5 percentage points for seniors housing and 3.6 percentage points for nursing care is great and really welcome, and speaks to a lot of the efforts that have gone on by a lot of operators out there. And we saw really strong demand in the second half of 2021. There was some pent-up demand that came into the market. And in the first quarter of 22, we saw a continued recovery, not quite at the same pace, but given how contagious we have with the Omicron variant going on, I felt pretty good that there was a continued improvement in occupancy in the first quarter of 2022. So now over to both of you, and starting with you, Craig, what do you see factors that are influencing the recovery in both skilled nursing and in senior housing? Is it supply story? Is it a demand story? Or where are we in your view?
Well, I'd say maybe I'll start with the skilled piece. So I'd say on our skilled in my opinion, in the markets and more in limited markets in the skilled world. But, we've seen a change in that industry. I mean, we've had some microeconomic changes here where we've had some nice new kind of shiny pennies that have been built that are just for kind of rehab, just short stay rehabs. We've also seen a pressure from the hospitals in, pushing residents that would normally be in our markets, pushing them to home health care. So we've seen some pressure in that. So the skilled nursing world has just seen a number of pressures really from different angles, in my opinion. And so our, some of what we're having to do is we're having to pivot and try to find niches to fill and be innovative. So on the switching to the assisted living, I don't think the recovery has happened maybe as fast as a lot would have hoped. Certainly, we all would have hoped that occupancies would have rebounded faster. Two, from what I'm seeing, I think that there is, it's very, as an operator, one of the things that we had to pay very, very close attention to as occupancies declined was the staffing piece, and there's staffing was difficult everywhere, so that's been a big challenge for all operators. But managing that staffing, make sure we weren't overstaffing to the occupancy, and make sure that we had everything kind of right sized. But also on the income side, I think the properties that will rebound the quickest financially were the ones that just didn't give the incentives during COVID, because we've seen communities that have given a lot of incentives, and their occupancy might be a little bit maybe higher on the higher end of the spectrum on the numbers that you're talking about, but yet the financial health of the properties, the communities, might not necessarily be there because of discounts that were given and things like that.
Yeah,
so I think
they bought occupancy, right? That's one way to say that.
Yeah. So I think there'll be certain communities that didn't do that will be able to be poised to rebound back to financial health much quicker.
Okay. And Brian, what's your view on the factors that are going to be influencing the recovery for both skilled nursing and senior housing?
Well, I'll start with, it's taken longer than I thought. So I expected that we would have a fairly significant rebound once tours opened up and once hospital procedures for the skilled nursing world began to happen at a more rapid pace. So I'm surprised a little bit that we're not further along than we are today. One of the things that I think is important to recognize is part of an impact. The impact of Omicron has been fairly significant. In December and January, every one of the operators, skilled or assisted, was having staffing shortages. And it was mostly due to folks being out for COVID. And I think that had a pretty significant impact on stalling whatever recovery we were feeling in, especially in January, what was normally for skilled nursing, a high occupancy growth month. So I do think that's been a challenge. I do think supply trends on the assisted living side will help us in the sense that construction costs are so high. New development has slowed. So I think on the supply side, when you think about occupancy being the most important piece of the puzzle, if you can charge correctly for it, the assisted living world is going to have a little better story on the supply side, because I think development has slowed and probably will continue to be in a relatively benign new growth world for a while, given the construction costs.
So what we have seen in the data is that demand, if you just look at demand, about half of the units that were vacated or placed back in the market have actually been refilled. But there was still inventory growth that occurred even during COVID, because there were projects that had been started pre-COVID and then they broke ground and they opened. So there was still inventory growth. Right. So that was one of the factors that has held occupancy down, because it's not just refilling up the units in your building. It's the fact that there's new buildings now that are competing with you. So our numbers are looking at both inventory and demand. Whereas when you look at a property specific occupancy, you're looking more at the number of units that are being filled. So there is some little bit of a disconnect in that, I think. But you're totally right. The starts fell. Construction lending stopped during COVID or slowed down dramatically. Starts fell, and that's translated now into slower inventory growth. Still positive inventory growth, but slower than what would have existed otherwise.
And I think on the demand side, you will begin to see that there's I think generally, like I mentioned to you earlier, I think generally households are in a pretty good shape from a savings perspective. And even if we head into a small recession, which seems at the very least very possible, we're going to be in a spot where I think demand will continue to grow. And if you've got a somewhat mitigated new supply story, then I think demand will help. On the skilled nursing side, it's come back a little bit better than assisted living, but it's still a pretty big challenge. And the good news is I think most of the operators on both sides, but particularly on skilled nursing, are more battle tested than they have been before. So when we go through this, whether there's another small wave or when we go through just dealing with the challenges that come with being a skilled nursing operator, they are more battle tested and I think more experienced, and you kind of understand the challenges that you're going to face in this industry a little bit better now than they would have been, because they have the support of the federal government and a lot of state governments to be able to bridge that gap, so they didn't have to worry about the financial piece of the puzzle as much as they would have otherwise. And they really focused on patient care, policies and procedures, PPE, and all the things that you have to do to take care of the residents. And I think that's going to be a positive as we kind of come out of COVID.
So let's talk about that a little bit more, about the role of federal dollars in support of skilled nursing and senior housing, in the sense that you had PPP loans in the case of senior housing. So how effective, how important was that? And is there still a continued need for federal dollars, in your opinion, going forward?
So Craig, I'll cover the skilled, and maybe you can hit the assisted and independent markets. I think on the skilled nursing side, the occupancy challenge combined with the cost of PPE and labor costs increasing would have collapsed the industry if it wasn't for the federal government support and a lot of state government support. So I think it was critical. If you think about that 12% drop in occupancy combined with higher costs and just the challenges of dealing with a COVID population, would have been catastrophic for a lot of the providers. But at the same time, those federal dollars and a lot of that support has dried up, and labor costs are still pretty high. Occupancy is not recovered all the way, and you're having to pay back some of those Medicare advances and some of the payroll tax deferrals. So it's becoming a little bit more, I think, stressed today. So for skilled nursing providers, I don't see more federal dollars coming into the system. I do think there's something a couple of things the federal government could do, and one of those is extending the public health emergency declaration that's supposed to expire on July 15th, I think. If they extend that by 90 days, it does a couple of things. One, it helps with the Medicaid assisted program to the states to allow for some of those Medicaid add-ons that a lot of the states put in place to help these skilled nursing providers. And it keeps that 3-day stay waiver to be eligible for Medicare in place for a while. And I think those two things, you can certainly help bridge this gap without putting truly more direct money into the system, and I think that's important. So there's a lot that could still be done, but it's it was critical during the 2020 and 21 timeframe to have that money into the system. Yeah,
I agree. So let's stay on skilled nursing for a second. There's more regulatory uncertainty is always an issue within the skilled nursing area. And now there's been a comprehensive reform package proposed by the White House. Anybody trying to keep this not political at all, but just any feeling about that reform package being bandied about?
Yeah, it's pretty hard for me not to make it political, but I'll try. We've been through this before, and I think the skilled nursing industry is pretty good at adapting to what's put in front of them. I think whether that's reimbursement structure, reimbursement changes, and in this case, regulatory changes and those types of things. So I think that the industry's gotten pretty good at responding to those changes. And most of the time, at least in my experience, what's announced generally doesn't make it all the way to fruition. And so I think I'm going to kind of reserve judgment on some of those things. It is hard when you've got federally mandated, whether it's staffing ratios, which is included in the CMS proposed rule. Those types of things are hard to manage, and really one size doesn't fit all. So I think some of the states are realizing that they can make some changes and the state of Florida is a good example. They've just changed legislation to reduce staffing ratios. And so there's some things that are happening that I think will be helpful as far as what's coming out of the White House and whether it's Elizabeth Warren or whoever it might be. There's I think a little bit of a wait and see approach that I think we need to take.
Okay, great. Thank you.
Yeah.
Craig, how about back to like the senior housing industry in terms of the role of federal dollars through PPP loans or the lack of funding that came through other sources? What's your feeling about that and how the industry is stacked up, ready to go forward if any kind of federal support still needed?
Well, I think I certainly think for the seniors housing world, I think the support that was given by the government was certainly welcomed by all operators, and I think operators would say yes, we take more of it. But it's certainly was. I think on my side, I agree with what Brian was saying. It was much more critical for the skilled nursing arena. It was just, it was kind of life and death for a lot of operators there. And I would say, and going back to the skilled side of things, I agree with Brian. Brian mentioned that there's a lot of legislation that gets passed. It doesn't fully make it all the way through because they pass it, and then they get so much pushback from the operators and things that just don't make sense out in the field. I would love it if they would take more of a collaboration approach, right? And rather than passing something and then having to walk it back, take a step back and really seek the input of the operators and those that are out there really trying to operate under these regulations and seek their input on how to better the system. We've got to.
Yeah, in my observation, there's a lot of unintended consequences that come from different legislation that needs a lot of thought could be put into it. And I totally agree. Collaboration would really help on that front.
Yeah, absolutely. But it causes, how much time our team, when something would get passed, we'd go, okay, we'd read the pages and pages of legislation. Okay, these are the changes that we've got to make. And we go, some of these don't make any sense. But then we try to prepare because it could be coming down the pipeline. So we prepare, we make preparations, and then, then we go, oh, well, it doesn't get passed, or that portion of it got stayed or taken out. So we spend a lot of time on kind of what if, trying to be prepared for those scenarios. And a lot of them don't happen. So there's a lot of time that's wasted that could be better served with collaboration on the front side. And I think would better serve everybody down to the care, which is all important for the residents. But also, like you mentioned, there is a punitive, and there's a lot of punitive measures that even seem to be heightened, where instead of a supportive environment on, hey, how can we help support the operators? There's a lot of punitive initiatives that are out there from the government that are more, they think they're going to get better performance through penalizing, right? And I would like to see it on the front side go, how can we help prevent these scenarios versus, and obviously there has to be consequences, but I'd rather see more of a focus on, hey, how can we help the operators? How can we collaborate with the operators to prevent or provide assistance, so we make it a better environment and provide better care versus just the punitive piece.
Yeah, and there's a stick approach, but there's also a carrot approach or incentives that can go a long way too that aren't always used. Okay, great, thank you. So one more sort of policy type question. We know that Medicare has been shifting more to value-based programs away from fee-for-service, and the use of Medicare Advantage plans are becoming really popular and common among older Americans. So, Brian, for you, what do you think the impact of MA plans have been on SNF operations and revenues, and where do you see that going? Everything I read and hear and talk to people about, that Medicare Advantage is just going to be more and more dominant, yet it tends to pay less in terms of a daily rate for a lot of skilled nursing. So, how does that all work in your mind?
I think you got it right. It pays less, and it's increasing in its frequency of kind of involvement in the industry. And it's not only pays a little bit less, it shortens the length of stay. I think there's a little bit more of a focus from the MA plans that are pushing for a shorter length of stay and really driving that component as well. So it's impacting occupancy too. It's not necessarily new. So we've just been around for a couple of years, and it's kind of moving through the system, but its involvement is higher, and it's something that, to latch on to Craig's point, it does have a little bit more of a collaborative approach, I would say, than just dealing with Medicare or Medicaid. So there is a little bit of a benefit because you're talking to a business-minded individual on the other side when you're dealing with a Medicare Advantage plan. But there's no doubt that the pricing is a little lower and length of stay is lower. So it's impacting occupancy and your average revenue per patient day. So it is something to pay a lot of attention to. It's something that you have to have really good relationships with those plans if you're a skilled nursing operator. But you are talking to somebody who's, a little bit more business minded on the other side. And so, there will be a lot more, I think, collaboration.
Great. Okay. All right. So I'm going to switch topics and we're going to talk about transactions a little bit. And we at NIC look at transactions on the price per bed or price per unit basis for skilled nursing or for seniors housing, respectively. And through COVID, despite some challenges that we've already talked about in terms of market fundamentals for skilled nursing, pricing held up. We're looking at, on our data at least, which is in collaboration with Real Capital Analytics or RCA in New York, on a price per bed basis, we're at about $91,000 a unit for skilled nursing in about, and that's been fairly steady for the last year. And that's probably up from about $75,000 pre-COVID. So any insights into that? It seems a bit of a contradiction. And how does that make sense?
I think it's just a function of the flow of capital into the industry. There's a lot of capital that comes into this industry. It's a little bit different than the last, I think, challenged period of time than when we went through the financial crisis in 2008, 9, and 10, because we had truly some demand issues there. And I think people generally view the COVID episode as something that will rebound. So on the private pay part of our industry, I think there's an attractiveness of some of the newer products, whether it's active adult, some of the age restricted type things, and those are gaining in popularity both with residents and with investors. And I think that's drawn some more capital into even the more traditional assisted living and memory care. So there's a lot of capital chasing deals. And right now there seems to be, in some cases, a disconnect between just the math around making returns work for an investor versus kind of the reality of the situation from an occupancy standpoint and the challenges that we're fighting from a kind of labor cost and just general expenses and the inflation and that core cost to operate a facility. We have seen some success with folks being able to drive rate for whether it's with, as Craig mentioned, if you didn't buy occupancy with discounted rates, you're in a pretty good position to make sure you're at market. And even if you're not, we've seen a lot of providers have success in changing rates. So I think there's a lot of capital coming in. I think there's some optimism that the occupancy rebound will happen and that you'll be able to adjust rates maybe a little bit more quickly on the AL side to get you to that equilibrium so that you're creating sufficient margins. I don't think you're going to get back for a long time to the margins we saw pre-pandemic, but you're at least going to be able to get to acceptable margins for an investor on the private pay side. On the skilled nursing side, it's a little bit different. Sometimes I can't make the math work because it is a very difficult environment. I think a lot of the demand from buyers of skilled nursing real estate assets primarily is a function of capital. There's a lot of capital chasing that as well. And I think the still robust financing market, whether it's, even though HUD's a little slow right now, that kind of floor that HUD provides, because if you can get to HUD, kind of the holy grail where you've got a low cost of capital, fairly high leverage, no covenants of substance. And I think people are still attracted to the skilled nursing real estate because that financing solution is out there. And so I think HUD provides a little bit of a floor to values because it provides such a cheap financing source if you're an equity provider to the industry. And I think there's a lot of still aggressive kind of bridge lenders that'll help you get there. And I think the financing market's been healthy on both parts, the private pay and skilled nursing. But I think that's the way I can justify some of the skilled nursing numbers that I'm seeing today.
Okay. Right. That's really helpful and insightful. Thank you. Craig, any thoughts about that in terms of transactions and pricing?
No, I really agree with what Brian said. And a lot of it's a function of the capital that's out there and willing to invest in the industry. So I think that's a big driver right now.
Okay, so let's talk more specifically about what brought Omega together with Arcus in terms of a specific deal that you worked on our property. I think it was an AL memory care property just north of Oklahoma City. So starting with you, Craig, can you tell us a little bit about the genesis of that deal? I think our audience will find that really interesting because it was a stressed asset that you guys have been able to refinance and then position it for growth.
Yeah. I'll try to speak in some generalities here as well. So we started with this asset. Really, I think it was probably 2 years, maybe 2.5 years ago, and kind of followed it with the current ownership and speaking to them about third-party management. We never consummated the deal, but continued to follow and kind of follow up with them. Eventually the property went into receivership, and we followed it through the receivership process. And that's when, we started talking to Brian and Cheryl with Arcus about this particular opportunity. And so that's how the deal came together and got formed. It was an opportunity. So.
Okay. And Brian, from your point of view, what kind of comments do you have about this opportunity?
Yeah, I think first and foremost, we were trying to find the right investment to make where we could involve ourselves with Craig and Lynn and Omega Senior Living. They're battle tested. They've got a very creative way and a very hard, strong work ethic to attack kind of challenged facilities. And this was a challenged facility. We tried to buy the loan from the bank. We could never get there, mostly because this was an inexperienced lender who probably didn't really know what the challenge was that they had in front of them. Once it ultimately got to a receiver, where a receiver was put in place, and we were able to reach a deal with that receiver to buy the facility, that's when we really kind of saw the value of the relationship that we had built with Omega Senior Living over in my previous role and in the role that I had with Arcus, and that Cheryl more importantly had with Lynn at Omega Senior Living. We really were able to work on a plan that made a lot of sense. It was not something that I would really wish on anyone. We had an inexperienced receiver. And I think, as we all know, the operations within an assisted living facility or a skilled nursing facility, or independent for that matter, is really what drives the cash flow. And there wasn't any cash flow because it was very poorly run. But Craig's team put a lot of work in, Lynn put a lot of work in, and we had a good plan going in. So when we ultimately closed, which was a fight to get there, we were in a position where we had a new team. We had fixed a lot of some of the low-hanging fruit was shocking that things were happening in this facility that were happening. So we were able to put ourselves in a spot where we could make quick changes. And having worked with Omega for several months beforehand to put that plan in place, it just felt like a really good fit for Arcus because it was opportunistic. We were buying it from a receiver, tried to do it a different way, but it was also a great opportunity to work with Craig and Lynn and put ourselves in a spot where we could make changes quickly and hopefully get out in front of the plan that we presented to our investors. And that's kind of what's happened.
So I remember in talking and prepping for this session today, we were talking a lot about labor and agency help and how that all works. So labor is such a critical issue for every operator out there. So talk a little bit about that. What happened in terms of maintaining staff or bringing in new staff, or what happened there?
Sure. So we were able, and this is, as Brian said, this was a little bit of a unique situation, but really we turned the whole leadership team and went out and found a new leadership team, excellent group that had familiarity to a large degree with one another. And so we brought in an entirely new leadership team really at the outset. So that was key, and having met with that team for really weeks before them coming on board, we were able to establish a relationship, a good working relationship with them before they kind of went into the hot seat, right, of this transition where there needed to be change, and there needed to be really immediate change as well. So that worked out very well. We ended up, really turning a bunch of the staff, trying to find the right team members. There was a lot of agency that was in there, which is, that's not an uncommon thing. We try not to use agency if at all possible, but we were able to turn a lot of the agency staff too and get them to come on board with us once they saw really the working environment and the culture that we had in the building. So when we go to do a turn,
specifically, I know you did some pretty basic things to try to change the culture, and the staff seemed to respond pretty quickly. I think vending machines that had fruit and things like that in there, and other sort of real just down to earth, basic common sense things, right?
Yeah, low hanging fruit kind of items is a lot of what we look for. I mean, what are the barriers that they have to doing their jobs and being able to do it well? And a lot of times, if you sit down and you just meet with the teams and listen, you'll hear, they'll tell you what their barriers are and things that they would like to see. And from some of our initial conversations, we repurposed one of the rooms there for a break room. And like you said, we brought in vending machines that do have fresh foods and fruits and sandwiches and whatnot in them, and charging stations, and TVs and a table just in a break room. So that was one of their barriers that really helped to improve their work lives. So that was easy. We also looked at all the processes and figured out how to streamline them. Again, what barriers were they having? We made changes to med cards. We made changes to things like that were really pretty simple fixes. But a lot of times those are the ones that can have the most impact the quickest for the associates. So that's we try to.
Has it been successful? Have you had success?
Very successful. Yeah, it's been very successful. The first month we were plus 16 on net move-in. So we had a exceptional, outstanding first month, which was unbelievable. But the team did excellent. The team really gelled, and that's what we focus a lot of too, is just solving their problems for them. And really seeing where we can help.
And Beth, that was when we first closed the transaction. Our expectations, we would not have a positive net move-in for the first 3 months, and we clearly, with the work that Craig's team did, they hit the ground running and were able to do that. Mm-hmm. And one of the other things that I think is important, and I can see it one of the questions, so I'll try to address it, and I'm sure Craig can too when we get to the end of the discussion. But we tried to align ourselves through the management agreement so that while we do have a base management fee, we tried to include incentives around NOI. We included some incentives on the total value of the transaction when we ultimately exit, so that there's a sharing and really an alignment between us and Omega, so that it's not your typical straightforward just a management fee. And part of the reason we did that is it was a turnaround, and more importantly, we want to be partners with these guys for a while, whether it's on this transaction or others, hopefully both. And we wanted to just set that standard up front, and we'll see how it works. And I'm sure we'll adjust it going forward, but it's something that I think we try to align ourselves so that we're all working towards the same goal. And certainly, so far it's been productive.
So this sort of fits in your new wheelhouse, I think, Brian, in the sense of working on properties that may be in distress, or in terms of creating opportunistic deals for yourself. So do you think that this type of opportunity, there's going to be more of that? Now, I've been surprised, to date, that we haven't seen a whole lot of stress deals in the market yet. But I'm wondering, it seems like that's part of your plan going forward. So are you anticipating more opportunities like this, and that you would be partnering with Omega?
I'm hopeful. I'm hopeful there will be more opportunities like this. I don't necessarily want to replicate this one because it was a super big challenge, but including emergency orders from the judge and all those kinds of things on the day of closing. But I think there will be. I think they're fewer and maybe not as frequent as I had hoped. But I think we're at the point now with some of the lenders in the industry who we're reaching the end of kicking the can down the road.
Right, exactly.
So there's got to be a little bit more of a time to face the reality of the situation, especially since occupancy hasn't rebounded immediately. So I think we're in a position where there will be more opportunities like this. I don't think it's going to be our entire business model, but it's something I think we have a skill set, Cheryl in particular, around finding these types of transactions and working on them. I'm surprised there haven't been more. I think there will be some now, because I think we're finally, now that we're into the meat of 2022, we kicked a lot of cans down the road in 20 and 21. So now it's time to figure out what we're going to do with the capital restructures that have to occur in the industry.
Yeah, I mean, when you look at the market fundamentals data, for example, in the first quarter, the overall occupancy rate for senior housing was 80.6%, but there were more than 40% of those properties that occupancy rates below 80%. And there's probably even a portion of that probably have occupancy rates below 60%-ish. So there seems like exactly right. You can only sort of withstand the pressure of low occupancy rate with slower revenue growth while your expenses are rising and squeezing your NOI for so long. So I would think there'd be a lot of workout opportunities going ahead.
And I think that will be exacerbated by the fact that both in skilled nursing and assisted living, I don't see any more meaningful government support coming our way, meaning true hard dollars. So I think, especially in skilled nursing, that masked a lot of the problems that would have occurred had the government funds not come in. So I think, and even so with PPP loans and some other things for assisted memory care, those types of things, I think without that government support, I think we'll have a little bit more of a kind of come to Jesus meetings.
Well, you also have the role of higher interest rates. So we've already seen the Fed's increased rates 75 basis points in the last 2 months, likely to go up to 2% this is on the short term end, likely to go up to 2% by year end, and probably 3 to 3.5% by sometime in next year, as they try to battle inflation. The CPI number came out today, year over year CPI inflation 8.3%. So they're taking this really seriously, the Fed, in terms of what they're going to do to interest rates to slow demand and slow the overall economy. So what's the impact of higher interest rates for some of these operators in terms of debt service and things like that?
Well, it definitely makes it more difficult. So I would imagine, a lot of people are starting to put a lot of thought into that now, including us. I think the first impact, it'll start to impact prices, is my guess, because it's one of the biggest factors in new acquisitions is what is my debt cost, and so that drives what I can or can't pay for a facility in a lot of cases, because I have an equity return that, while it's a range, you have to hit somewhere. So I think it will be a challenge going forward, and people are trying the best that they can to mitigate that with capital instruments. But I think it's going to be another factor that will drive that time to have a discussion around capital structure.
Yep. I know that when you look at financial. Oh, sorry. Go ahead.
I was going to say just one point. The only piece of the government funding that I'm seeing that is still trickling in would be for the employee retention credit, the ERC program. So I know there's a number of operators, depending upon if and when they filed for that. It's by quarter, and we're just starting to see some of those trickle in, of course, depending upon when it was filed for. So.
Okay. So I know, Brian, you've made comments before that financial performance is really related, especially in the skilled nursing area, to clinical performance. So can you comment a little bit more on that?
I think, and I've got some good slides that somehow I can't just hold up in front of you guys, but it's been a focus for us, and I think especially in skilled nursing, and even so, and I think Craig and Lynn have some great examples in in the facility that where we're partners, where the just simple day-to-day blocking and tackling and managing the meds for residents and managing the things they have to manage in a facility provides, reputational impact, a positive reputational impact. It gives comfort to families. But in a skilled nursing environment, it is dramatic. I think Ensign does a good job with some of their presentations demonstrating how EBITDA growth and coverage and financial performance is directly tied to some of the metrics. And it's really around the nursing care provided in a skilled nursing facility. It is probably the biggest determinant for us as we think about operators is the quality of care. And there's a few reasons. One, quality of care just provides a better deterrent for issues that you would have with a resident. It limits your time spent dealing with regulators. You're always going to have surveys, you're always going to have issues, but a consistent track record of doing well limits the amount of time that you have to spend on that. I think this is going to be an interesting time because there haven't been as many surveys through COVID as there will be now. And so it's going to be something that is more important, I think, over the next year as we get back into a regular cycle. So it's critical, and generally the people that pay attention to that, the financial performance comes with it.
Craig, any thoughts on that?
Yeah, I would just say that, when you talk about care, obviously that goes hand in hand with the employment piece of it, right? And having the right staffing and whatnot. And so I think one of the things that is going to be critical kind of coming out of this is going to be the culture that these companies have. I think the companies that have good cultures that are out there and that work to have the right programming and things like that take care of the associates who then provide the care, right, and have the right training programs and everything that goes along with it. I think those are going to be the companies that are successful long term and providing that level of care that we're all seeking for, and also the financial performance that follows from that, right? But fundamentally, you got to take care of the associates that are going to take care of the residents. And so that's a big piece of it, and a big focus of ours is on the culture piece.
Mm-hmm. Okay, folks who are listening, if you have any questions, please submit them. And I have a couple questions I'm going to ask to our panelists. So in the wake of the pandemic, is there been a move that you've noticed, at least, to make architectural layout changes to facilities that prevent the spread of infectious diseases? And what resources do facility operators need to make those adjustments? Have you seen that in your? I've seen that in the senior housing area. That development is taking that into account.
I'll mention one thing, and then Craig probably is better suited to answer this question. But I toured a facility last week. One of the nicest facilities I've seen. It was here in Georgia, and it's new, so they had the ability to make these types of changes. Really big, wide open spaces. It was a large facility. Big wide open spaces, and I think more importantly, the air purification systems and the infrastructure that was built into the facility, I think, to handle a lot of what some of the older facilities aren't able to handle is critical, so that you can, make sure that your air quality is as high as possible, and you're dealing with, kind of like on a plane, you're dealing with a fairly confined population. That was something they put in day one, and it's really been impactful for them.
Yeah. Craig, any thoughts?
Well, I would say, going through COVID, as much as the operations had to change, especially on the skilled side, we learned a lot from that, because as soon as you got COVID in the building, you essentially had to go into opening up another business, right? You couldn't have employee crossover. You had to section things off, even wall things off. There's all kinds of things that had to happen. So I think we learned a lot from that, and I think the industry did in general as well. One of which was, too, like Brian said, the spacing piece. Being able to space out dining, and if you have to, have some kind of separation. Also, the flow of some of the services. I think some of the kitchens, some of the way things are processed and the handling, the flow of work is going to change because of that, so that you can, serve meals better in rooms and do some things like that. Also, there's some new technology that's come out, that just helps on the front side prevent some of the spread or screening right as you come in. There's technology where you can walk in and it kind of screens the person walking in looking for temperatures and things like that. That just makes things a little easier. But
yeah, I was talking to an operator yesterday who's doing some new construction, and they were saying that they're changing the ability on how to deliver food and thinking more in terms of like a hotel mindset, that if you move into such a crisis again as COVID, they have to have a better way to deliver meals to people. So the idea that a new building can plan for that is harder, of course, for something that's already existing. But I think that I've talked to a lot of architects that are thinking of new ways to design buildings to make isolation wards easier and things like that to keep the rest of the population safe. Agreed. So one other question here is, let's see, hold on. Let's see. So back on valuations, in terms of when we were just looking at those prices for skilled nursing, I think we touched upon this a little bit, but specifically, did the sort of government stimulus impact values in the skilled nursing area? I think you talked a little bit about this, Brian. Do you have any other comment?
Sure. I think to a certain degree it does impact value, and I think it does in a couple of ways. First, if you're an investor in the space, there is a level of comfort that comes with knowing in a time of national crisis, this is going to be an operational entity that's supported by the federal government if need be. So there's a little bit of a floor support that I think provides a floor to some values and at least some comfort, and de-risks that stroke of the pen risk a little bit, because it is such an essential service. So I think that does impact values. The dollar amount that was dollar amounts that were kind of forced into the system, I don't think that's a permanent change or support of value. It was a 2-year period, and I think we've been through it. So I think it's more about the general support of an essential service that provides some enhancement to valuation. But I think that the actual dollars is, when you think about a discounted cash flow, that's in the past now. So Probably not.
Okay. So someone had asked me to repeat the national occupancy numbers for skilled nursing. So I'll do those right now. So pre-COVID, which was the first quarter of 2020, the occupancy rate for nursing care was 86.6%, 86.6. The first quarter of 21 was 74.1. So it had fallen 12.5 percentage points. And a year later, in the first quarter of 22, which is the most recent data we have, we're at 77.6%. So we've recovered about 3.6 percentage points, but we're still down about 9. Okay, so I have another question that this is from someone who has a brand new assisted living and memory care facility. It's about to open in Texas, and owners are all new to the industry. So what do you think, probably this is for you, Craig, what do you think are the best advertising and marketing routes to start to get residents on a waiting list?
Oh, wow. That's a big one. We'll typically start on a new build 9 months out, depending upon what it looks like. Really, some of the services we'll start 12 months out. We'll start by building the website and building the branding and whatnot. And we have a team that does that here in-house. I'd say a lot of that is starts way back when on the branding piece of it. We've got things that we do every month leading up to a grand opening. So it's a lengthy process, but and I don't know particularly about the micro markets or the markets that he's talking about in Texas. So, but we do a lot with SEO and SEM on the internet. So we generate a tremendous amount of leads from the internet advertising. And then we spend a lot of time just boots on the ground, getting involved with getting involved with universities, getting involved with senior centers, getting involved with any place we can get involved in. We try to create partnerships where it's a win-win, right? We're getting to advertise our product. Eventually when we open up, we want to have the win-win where they're bringing something to us and we're adding value to them. And so just looking for those win-win relationship opportunities really helps with the marketing piece. So that's pretty general, right? But word of mouth is always great, but we hit the internet very heavily, and also just boots on the ground, getting involved with the neighborhoods.
Yep, that makes sense. Of course, good common sense. So I think we have time for one more question.
The right amount of money to throw at those things too, right? You got to spend dollars to do it, but we don't rely just on the dollars. We do a lot of work on the ground floor, and Beth, our VP of sales and marketing, and the team do a tremendous job of just of really getting out there and getting involved in the community early on.
Okay, so one more question here. If you think that there'll be limited or no federal assistance to skilled nursing facilities going forward, ACA has a forecast of that up to 50% of the SNFs will fail without assistance. Do you think that's an overreaction by the projection there, or do you think that that's a reasonable outlook?
I've seen a lot of small operators in rural markets that are really struggling. So I think a lot of the mom and pops that were out there in rural locations, very small areas, I think they really struggled to deal with all the regulatory environment and all the changes because they didn't have a lot of the back office kind of backbone to help facilitate just the rapidly changing environment. I remember our team on so many occasions would spend all weekend redoing policies and procedures. And then come Monday, there'd be another change, and it was almost one of those things where you just throw all the papers in the air and go, okay, back to the drawing board. But I think a lot of the rural operators, small operators, have struggled, and I think also the staffing has been exaggerated in a lot of those markets. So I think that's something that's a real problem, and a lot of those little markets, Beth, that's going to be the primary employer. And a lot of those little markets.
Yeah, we've been talking about that.
Yeah, if those go belly up, I mean, it's going to have a dramatic impact on some of those little towns that are out there all across the states where, I mean, it could lead to a lot of those little neighborhoods, kind of cities, towns drying up. Yeah.
So I think we have more questions, but I don't think we have time for them right now. So Brian and Craig, I really want to thank you so much for your time and for your insights on so many factors influencing property operations and returns performance as we continue to emerge from the pandemic. You provided us a lot of great insights, and I thank you for that. I do want to welcome everyone to join us again in 2 weeks from today at the Wednesday, May 25th at 1 p.m. for our next set of leadership huddles. And that's going to be featuring prominent real estate directors. They're going to discuss market trends and the economic outlook. Our guest specifically will be Mike Acton. Mike is a former colleague of mine for many years. He's a managing director and he leads the research group at AEW Capital Management in Boston. And Mary Ludgin, who's also a good friend. She's a managing director and leads the research team at Heitman. In that discussion, we're going to learn about more discussion about what's going on with the economy, what's going on in Federal Reserve policy, what's going on with inflation. We're going to figure out a little bit and talk about how these leading economists are advising their teams and clients about the changes and the challenges going on in the economy. Will there be a recession next year? And how do you react to that? Is real estate an inflation hedge, as we often think about it? And which property will fare best? And also, of course, a discussion on seniors housing. Then we also invite you to start to think about already the 2022 Fall Conference. That will be taking place in September, from September 14th to September 16th. And that's going to be at the Marriott Marquis in Washington, D.C. Registration for the conference actually opens next Wednesday, May 18th. So get ready. You can learn more about the event, of course, at our website, fallconference.nic.org. And with that, I'd like to wish everyone a great day. Thank you for having joined us. And thank you, of course, to our corporate partners and sponsors as well. So Craig and Brian, again, thank you so much for joining us today. And goodbye, everyone.